Hello and welcome to webinar series hosted by Happiest Health as part of Women's Wellness Summit 2024. I am Kumaran and I will be your host for today's session on all about women and mental health. While juggling between multiple roles at home and at the workplace, it is not uncommon for women to experience bouts of anxiety and depression at times. Without shying away from seeking help, a woman experiencing a bout of feeling low must ensure she gets the right treatment and is being heard. Mental health includes our emotional, psychological, and social well being. It affects how we think, feel, and etc. It also helps determine how we handle stress, relate to others, and make healthy choices. Mental health is a major factor in a healthy lifestyle when we make difficult choices to deal with stress and to relate with people in the other world. Yet, mental health isn't just something we can deal with once and then get over. It's important in every stage of our life, from infancy all the way into our adulthood. Mental health is something we need to be cognizant and handle with care. Happiest Health is organizing a summit on women's wellness on 16th March 2024 at St. John's Auditorium, Bengaluru from 9 a.m. To know more about this summit, please log on to www.happiesthealth.com and register now for the summit. Without further ado, to discuss more on this, we have with us an esteemed panel members. First up, we have with us Dr. Divyambigai Rajendran, an obstetrician and gynecologist at Apollo Cradle, Karpakam, Chennai. She has over 10 years of experience in obstetrics and gynecology. She completed MBBS from Madras Medical College, MMC, Chennai, DNB, from National Board, Delhi, fellowship in minimal access surgery in gynecology and fertility training from Crest National University Hospital, Singapore. Her areas of interest and expertise: fertility treatments, ovulation induction, IUI, IVF, ICSI, high-risk obstetrics, gynec laparoscopy, and hysteroscopic surgeries. We welcome you, ma'am.
Thank you.
Next, we have with us Dr. Ashlesha Bagadia, a psychiatrist and psychotherapist specializing in mental health of women and young families. She is co-founder of the Green Oak Initiative Community Mental Health Center, Bangalore, which is a collaborative organization that caters to a range of mental health issues of varying degrees of severity and focuses on preventive interventions and recovery-based care. She's also co-founder of the Park Academy, which is a training center for advanced psychotherapy services across all medical and psychological disciplines in South Asia. We welcome you, ma'am.
Thank you.
And our next panel member, Dr. Asfia Khalil, consultant psychiatrist at Vasvi Hospital, AV Hospital, and director of Umeed Psychiatric Hospital, De-Addiction Center and Rehab Center, Bangalore. She deals with all types of addictions, bipolar disorders, depression, and schizophrenic patients. Works with underprivileged and provides free consultation and medication at HSIS Clinic in association with Rotary Midtown. We welcome you, ma'am. To begin our discussions, I'll start the questions very briefly to all the three panelists. The first two rounds, we'll go across with different questions for all three of you. And the last round, I would want a common question to be answered by all of you around this particular topic. To move on with Dr. Divyambigai, ma'am. Ma'am, do gynecologists notice mental health issues in women who come from consultation for other typical gynecological issues?
Yes. Yeah. Good afternoon, all. Yeah, being a gynecologist, we see women across all age group. This mental health issue is like not a separate entity. We do see some mental health problems associated with the gynecological issues as well. To be very precise, like we do see this PCOS, polycystic ovarian syndrome women, where it is the most common, highly prevalent across Indian girls. So then this syndrome, polycystic ovarian syndrome, it is associated with irregular periods, and they have this acne, eruptions, pimples issues, and male pattern of hair growth, like excessive facial hair over the upper lip chin, and there will be a male pattern of baldness, like losing hair on the scalp, alopecia, and obesity again. So these are the various symptoms of this PCOS woman. So this is actually a gynecological problem. But then when they suffer with such symptoms, they do have associated mental problems because of the body shaming and the like lack of self-confidence. And when they get these, no, especially the hirsutism, the hair growth and the obesity. So these are the main things. So we do see mental health issues in PCOS women, mainly depression and anxiety problems. So we screen them. No, when they come, we don't just treat the PCOS. We do make an assessment of their mental health, and then we guide them accordingly. And apart from this PCOS, which is common in the reproductive age group women, and the next set of women we deal with is like perimenopausal and menopausal, like around the age of 40 to 50 years. This is again a very vulnerable period for mental health issues because of the hormonal fluctuations and the symptoms they undergo because of the hormonal fluctuations. And one another thing I want to make a note about this muscles. This is like every woman will be suffering every month because of the periods just before the onset of periods, that is called premenstrual symptoms. It can be very mild where they ignore, but it can be very severe where it can affect their day-to-day activities. Severe, what I mean is not only the physical symptoms. Physical symptoms may be like bloating, breast pain, leg cramps, back pain. These are physical symptoms, but these women do have suffer from mental problems like being irritable, anxiety, depression, lack of sleep, insomnia, and they'll be like more of like very mood swings, no, very vulnerable, no, they'll get short tempered, anger, feeling tired, weak, all those things. So these are like something related to the mental health issue also that happens like every month. So we do see such women struggling every month with these symptoms. This is like another category of this is called PMDD, that is premenstrual dysphoric disorder. This is actually extreme form of PMS where they present with more of psychological symptoms. Sometimes it will be too severe that it can have impact on their personal life, interpersonal relationship, even career also. So all these varied presentation of mental health issues associated with gynec problems we do encounter, and of course we give a holistic care to the patient by assessing them and then guide them accordingly.
Right, ma'am. Very well said about how even gynecologists also deal with a lot of mental health issues. On that note, I would also want to come to Dr. Ashlesha Bagadia. Ma'am, how does mental health issues present or manifest across different age groups in women? While Dr. Divyambigai treats gynecological issues in all kinds of patients, how does mental health present in all kinds of ages, ma'am?
Thank you. Thank you for the question. And thank you, Dr. Divya. I think that was very nicely describing the, the mental health aspects of gynecology problems. So I'm going to start from puberty. So if you look at, puberty, because I think below the pubertal age, the presentation of symptoms may be sort of uniform across genders. So I'll focus from puberty. We heard during puberty itself, there are a lot of psychological changes that a girl goes through. So the psychological problems that we see them is with, say, body image disturbance, because their body is going through difficulties. They may, if they start having, premenstrual symptoms, menstrual cramps, so that can have an impact on their mental health. There is anxiety that we see in young women, also eating disorders or difficulties with navigating their body and eating habits. So these are the early kind of mental health issues that are linked with gynecological problems, but also young girls, especially nowadays, can be at risk of depression and anxiety because there's a lot of pressure from peers, pressure from academics. So the adolescent period and this early young period, they can present with common mental disorders. Also, as the age progresses, as we see young adults, the early sort of career women, they present with stress-related disorders, especially if they have to try and balance work and compete in a work environment that may or may not be very helpful. So we see a lot of workplace related issues for early career women. The most significant time for a woman, I would say, is also the period around pregnancy, perinatal period that we call. And if a woman has a risk of, say, any other genetic risk, family risk of developing a mental health condition, then a most vulnerable time is just after having delivered a baby. So the postnatal period is the highest risk time for a baby, for a mother. And so their chances of getting postnatal depression, postnatal anxiety become very high. And that is a common, in fact, it is way more common than it is presented, because it is still not very, commonly talked about, especially mental health symptoms during pregnancy and postpartum. Moving on from the pregnancy period, the middle-age period where women are, especially nowadays, women are perhaps going through relationship difficulties, relationship breakups, divorce. So there are these relationship-related issues that come up a lot in the middle sort of ages. They may also present with losses as older people in their lives die, and they may or may not have been able to manage that. We also see a lot of families living separate from their family of origin, right? There's a lot of migration that we see. So if women are getting separated from the relationship, having breakups, they are trying to manage it alone. They're no longer well supported by a network. So we see a lot of grief-related, relationship-related issues in the middle-age groups. And as they grow older, especially if you're thinking about changing of age, one of the common ones is menopause-related mental health symptoms like depression and anxiety. We also see mental health symptoms that can come from having chronic illnesses, like say diabetes, hypertension. If they've had, say, a medical condition, we know that after a heart attack or after a stroke, the chances of having mental health symptoms goes up. So chronic age-related symptoms can also come much later. So this is like a little bit of an overview of what you might see in a common space. I'm not talking about the severe end, like say severe disorders, but commonly these are the kind of lifespan related conditions that you might see in women.
Yeah, the way how it's presented in all kind of groups. Okay, right, ma'am. So when we talk about this, Dr. Asfiya Khalil, this point of how Dr. Ashlesha and Dr. Divyambika also pointed out that, of course, there is mental health issues women do face, men do face, everyone do face, but there is some kind of a stigma associated with women who face mental health issues. And how do we help women and their family deal with the question to the psychiatrist?
First of all, we should try and start dealing these mental health issues as disorders. These are all health-related issues. So if you start reducing the stigma this way, treating it as a general disorder, then I think people will be more open to getting psychiatric help. So, and this has been happening. I think all the celebrities have been talking about these issues. That has caused a lot of change in the society. I'm actually very happy with the trend these days. Now people are opening up, they are coming. So I feel even the young girls, no, the youngsters are putting their foot down and saying that we need help. Take me to a mental health professional. So I'm seeing this trend of late. So which is a very positive thing. And we need to kind of build on it and promote this by like organizing more of these educational events, mostly in the schools and colleges. So if we target the young minds, I think the stigma can be reduced. So that is the vulnerable population we should target. We should like kind of have more programs for youngsters so that they, once they grow up, they are more open to dealing with these mental health issues. And they can force their parents to come treatment. I think young minds are what we should target and have more of these educational programs, talk about it openly. You know, and other doctors should also encourage their patients to go and seek mental health help if they require it. And if the society at large, if they see somebody in the family having these disorders, and if they encourage them to take help, that is also like a very big help to the patient these days. especially the family, which forces the patient to come and seek help.
Yeah, ma'am,
So we should have more of these education programs.
Yeah. On the same point that you said, on more of people, where you said that the family should ensure people, as in the person who's affected with mental health issues, to bring it to psychiatrists like you. I just wanted to understand, do you still see people coming along with someone, bringing them to your clinic, or people walk in alone? So there are these two things. People are aware that, okay, I need support, so I go to you, or in your family, do you see people and people come to you? Are there people who come as a family to you?
Yes, there are. So there are a lot of youngsters, even the teenagers these days, no, they come alone and say that I need help, help me out. So I'm saying that trend. Plus, I'm seeing people around them, like, around the patient, recognize their friends and their families and the extended family. They recognize that this person is having issues and this can be sorted out. So they bring the patient to the mental health professional. So I'm seeing both these kind of trends these days.
Right, right. Okay,
And other doctors also referring patients and saying that my
absolutely.
patient needs help.
Absolutely.
So that's
Absolutely.
a good trend.
Right, right. Okay. Of course, we talk about this entire mental health as a segment in one of our Women's Wellness Summit that's happening on 16th March. We have a separate segment where we will talk about women and mental health issues while also talking about many other things about women's wellness. Again, to take this question to Dr. Divyambige, ma'am. So, ma'am, what does you have, of course, when you started your conversation, you did tell about how hormonal changes do play an important role. Again, I would want to highlight this a little more and come deeper into the topic. What role does hormonal changes during menopause play in a woman's mental health, ma'am?
Yeah. So menopause is a very significant area. Like it's a significant time where there will be a drastic transition from the reproductive age group to the menopause, where normally women have this estrogen, that is the female hormone secreted by the ovaries. So what happens during menopause is the ovaries are stop functioning. So when it stops functioning, there will be a drastic fall in the estrogen, the hormones in the body. So estrogen is very good for women's health, like in terms of it's protective for the heart, it is protective for the bones, memory, and everything. So when there is a drastic fall, there is a drastic decline, the hormonal fluctuation causes impact overall on the physical health as well as on the mental health. So what happens is like perimenopause. Menopause is like complete cessation of periods for 1 year. That is called menopause. That is a woman who doesn't experience any period for 1 year, then we call them as menopause, like call them like they have attained menopause around the age of like from about 45 to 52. That is the average age for Indian women. So here, before even they attain menopause, there
Yeah.
is a period called perimenopause. Perimenopause is few years leading to menopause. That is starting from 40 years onwards. They will start experiencing all these hormonal fluctuations and the impact on their physical as well as the mental health. Coming to this hormonal fluctuation, what does it causes is, first thing is their basal metabolic rate goes down. So whenever our metabolism slows down, there will be a weight gain. That is one of the symptoms. So in the perimenopausal women, they have a complaint, they have constant worries about their weight gain in spite of them doing their proper workouts and dietary managements. They feel like, why doctor I'm gaining weight in spite of my effort. So that sort of some issues slowly peeps in. So there will be a weight gain as well as because of the hormonal drop, like when the bones are getting softened, like because of the weight gain as well as softening of the bone, the osteoporosis condition, there will be joint pain, knee pain, all those things. Everything slowly comes in. Then other symptoms of hormonal fluctuations are this all these are irritability, short-tempered, anger, lack of sleep. That's another thing. Insomnia noticed around this perimenopausal and menopausal women. So these are the various symptoms women undergo due to the hormonal fluctuations. And of course, around that time only, like kids will be like moving on to their college, and they'll get them married and all those things. This emptiness syndrome where they'll be alone at home, no other more like. Work to do, something like that, no, some vacant thing, like some vacuum in their life, something like that they feel. And with this superimposed physical symptoms and the feeling of growing old, all those things they have contribute to lot of mood fluctuations in them, and that's how, like, we do treat them with medications as well as counseling also, to just reassure them this is a normal thing for every woman. They have to undergo all these phases. It's purely because of the aging factor and all those things. We do reassure them.
Yeah. Okay, thank you, ma'am. Thank you so much for bringing that. I'll go back to Dr. Ashlesha about, again, I talked about menopause and then I'm coming back to you because of your specialization. Ma'am, as a perinatal psychiatrist, you have dealt with new mothers a lot. What are the issues that new mothers face in terms of their mental health, ma'am? Because it poses to be too large for women at that particular stage of life. So what do you have to say about it?
Yeah, so it's definitely one of the things that I work very closely with. So one of I think, like Dr. Asya mentioned, the awareness is rising in women. So what people know about, I'll start with the most common thing that is known as the postnatal depression, where women tend to get a really low mood about 6 to 7 weeks. So in their second month after delivering the baby, because this is a time where they have just gotten over the initial frenzy of, the baby's born, its rhythm has settled, and they've also stopped seeing their obstetrician because everything is fine. Now the focus shifts on the baby, and that's when the mothers, as the hormones are settling in, if she's going to develop postnatal depression, that's the time when the focus is least on her. So postnatal depression, of all the perinatal conditions, that is the most common one. And it presents with symptoms like feeling low, even when there are lots of happy things happening around you. The baby is kind of maybe starting to smile and there are lots of relatives around. The sleep disturbance is not just any normal mother's sleep disturbance. Even when nothing is there to do, they're not able to fall asleep. And they can't stop crying. They can't feel like they have no connection or bond with the baby. They may also feel like, the baby seems to be happier with other people than them. So this postnatal depression, the vulnerability to this period, depressed mood after delivery, can stay up to 1 year. So sometimes if they get depression or low mood, even when the baby is 6 months old, they don't realize that it could be postnatal depression. Okay. But it is often linked to the pregnancy. So that's something that awareness is definitely rising. In severe end, if the mother becomes really unwell during postnatal depression, she can also have thoughts of ending her life. It can get that severe. Sometimes there is a lot of frustration and regret as to why they had a baby. So there may be thoughts of harming the baby. That is very, very rare, but it's there. So this is postnatal depression. But there is also something which is there, which is not really talked about or picked up very easily, is postnatal anxiety. And that is something that I feel women experience a lot more, because there is so much that they have to juggle. They have to make sure that they look after the baby well, even if they have help, like a nanny or someone else. It's the mother who has to make sure that the nanny is doing the right thing. And so trying to stay on top of these things, there is so much to go on. So they can also become anxious. They can start getting panic attacks. They may also, during this postnatal period, working mothers may have to go back to work and make sure managing work while they're managing home. So there are a large chunk of women who may not with to a psychiatrist clinic or a mental health practitioner, but they often end up having anxiety and panic attacks, and they may not look sad. They may not look like they're crying, or they may not look like a traditional depressed person, but they may actually be suffering a lot with distress. So postnatal anxiety is the other period. But also what we now know very clearly, there can be depression and anxiety even in pregnancy. And this is much harder to talk about even for the woman herself, because the moment, they become pregnant, first of all, pregnancy itself can happen in quite ambivalent stages. Mothers may not be ready to be pregnant at that time. They may have planned something in their career, or they may have just got married. So if a pregnancy occurs when they hadn't thought of it or hadn't planned, that it starts off on a stressful note, many mothers are able to reconcile, with their partners. They're able to sort of make a plan, make changes to their life, and it seems to be okay. But if they haven't been able to, or if the stress continues, then they can actually have depression or anxiety in pregnancy, and it's kind of masked. So they may present with more irritability, which is kind of written off as mood swings, So that is something that can present in pregnancy. Another thing that can happen for, especially now, like I mentioned, because there are our population in India is constantly on the move. We're not so close, living in large families. So we're often isolated, trying to juggle things on our own. So mothers, if they become pregnant and they're working, they often have a lot of things to do, and that can add to the load. And they feel like they can't share that, I'm feeling sad, because pregnancy, everyone is expecting me to be happy. So we are also seeing pregnancy-related mental health issues. Of course, and Dr. Divya may agree with this, that many couples we are seeing who become pregnant after a long trial with IVF. So that process of going through the IVF, infertility, that itself is so stressful.
Sure.
So they may have already presented with anxiety and depression, not inherently from within, but because of the stress they went through. And that could be the phase they're in when they enter a pregnancy. And there may be so much anxiety that, okay, I managed to get pregnant with such difficulty. This is like a precious pregnancy. So
Yeah.
the slightest medical complication can make them very stressed. So we are seeing a whole gamut of problems that can present in a pregnancy period.
Yeah, right, ma'am. Thank you so much for putting this across in a big sense. While we talk about this entire mental health issues, there is also something that we need to address. While talking to Dr. Asfia ma'am over the last so many months and years that in our interactions for our stories, we also find that addiction is not always a man's problem, but it's also a human problem. So, what are the challenges women face when it comes to overcoming addiction, ma'am? While we talk about mental health issues on the one side and the addiction on the one side, the addiction is something everyone goes through.
Yes, with the modern lifestyle, I think addictions are on the rise in the females also, but
Yeah,
it is not socially accepted, right? So you
yeah,
can have a male who is into addictions or he's using substances, and it is socially accepted. The family just does nothing about it. But if a female is into addictions or if she's using psychoactive substances, she is looked down upon, right? And it is not socially accepted. So when she goes for help, even the people around in the hospital may not look upon her with dignity. So it rather like deters them from going and seeking help because they are not given the same kind of treatment or the respect what the others get. And
yeah,
there are no centers which treat females, female addicts. So when you have around 40 to 50 centers in Bangalore itself treating male addiction problems, there are only one or two centers which cater to females. Even though the burden is less on the rise, we need to do something about it. And females come with personality issues. So if they have, say, bipolar disorder or they are having EUPD, so emotionally unstable personality disorders, or their impulsivity traits are there. So these are the ones who are more prone to get addicted. So we are not dealing only with addiction, but we are dealing with either a psychiatric disorder and a personality issue as well, which becomes very difficult to treat. So it is easy to handle a male addiction center, but it is very difficult to manage a female addiction center. Okay, so because they come with all these issues.
yeah.
Second, the family also suffers along with them.
Okay.
Yes, because the females are the backbone of the family. If they are into this, then the whole family is at a loss. So the children get affected. They have interpersonal issues. The children have issues with their studies, and the husbands also have a lot of discord. So marital discord also sets in. And if they have to plan pregnancy, sometimes it is not possible to where they're addicted. So they have to plan things accordingly. So they have to come out of the addiction and only then plan for a pregnancy. So this is one added problem. And if they get like pregnant on a drug, it becomes very difficult to manage. They either have to go in for an abortion or they have to be very carefully monitored and kept in a center throughout and delivered. And so prevention is the best thing. So when we work on prevention, like we usually target the male students. Like when I go to school, they're mostly male students coming in, not a talk on addiction, but there are very few females who are present there, the female students. I think we should also target our prevention programs to involve the current generation, and especially the IT companies. If they start organizing prevention programs or these preventive lectures and talks, even for the female employees, that will be a very big step forward. And
Right.
I think these are the major issues with female addictions.
Right, right. Thank you. Thank you so much, ma'am, for sharing this part of the topic as well. To sum it up with one last common question to all the three of the panelists is that doctors, a woman is expected to strike an ideal balance between work and family. As a result, sometimes or often, she also fails to take care of the physical health as well. What impact do these factors have on our mental health? So I'll start with Dr. Divyambige and then move on to Dr. Ashlesh.
So yeah, like once the physical health is well, then only it will be like that's a base, no, right? So whenever there is a problem with the physical health, naturally the mental health issues also will be following it. So especially for women, as I already discussed, like because of this weight gain issues, that is one thing women are like too much worried, and sometimes no, when they juggle between the work and the family and all those things, they are not taking care of themselves in terms of nutrition. So we generally advise them to concentrate on balanced diet, ask them to have like small quantities, frequent intervals, that will be helpful to replenish their energies, as well as to cut down on the excess weight if at all they are struggling to lose weight. So balanced diet is one important thing they have to follow, and then hydration again. So all these are like when you are like dehydrated, you feel very weak, tired, and then again the output comes down, and then it can end up in so many other physical symptoms like urinary infection and all those things.
Yeah.
So hydration is one important for like for especially the working women. They have to ensure that they take at least 2 to 3 liters of water fluids per day to keep themselves well hydrated. And then of course some sort of stress relief, no, to improve their physical as well as the mental health. Some sort of physical activities,
Okay.
be it a walking 30 minutes a day or some meditation, yoga, something like that. People, I know it's very difficult, but somehow or other, especially the family members also sometimes, so they have to accommodate, to take care of some of the responsibilities from the women so that they can invest some time in like their self care
Yeah.
in terms of exercises, no, physical workouts or some sort of physical activities daily. And of course, the sleep pattern again. This is again a very challenging thing for the working woman. 6 to 8 hours of sound sleep is very much advisable for the physical as well as the mental health. So here, maybe if they are working in a different timeline, like night shifts, all those things, if it is really affecting health, then probably they have to somehow like talk to their employers and change in the timing, something like that. And then this gadgets again, women, in spite of the busy schedule, in between whatever little time they get, they invest that time in using like yeah, probably some restriction on that, and some more time to be health in terms of like some time to take care of themselves.
Absolutely.
Yeah.
Yeah, yeah. On the same question, ma'am, to Dr. Ashlesh Pagadia.
So if I understand your question correctly, you're asking us what is the impact of physical ill health on mental health
Correct.
and what women can do to look after that, right?
Yeah,
So
because for example, the point that you are also raised about postpartum. So even in postpartum, while they are taking care of the baby's food, sometimes mothers don't have food, and that lack of energy might affect their mental health. So anyway, so yeah.
Yeah, absolutely. No, you're very right. So one of the things that I completely agree with what Dr. Divya mentioned, in terms of all the various things that women can do, but the problem is that women are not able to
Yeah.
do because I mean, like I mentioned earlier, there is a lot of that's going on. There are so many things that they have to do that their never mind nutrition, just their basic regular food intake is the last in their priority. Their basic water intake is last in the priority. So if things are smooth, then they can perhaps do the bare minimum of having 3 meals a day, drinking enough water. But what tends to happen, especially say if they are in the postnatal period, or if they have things happening, like other health conditions, is that their priority for themselves goes down and everyone else takes on priority. So one is, normally they're not able to look after their physical health, but that affects their mental health. If they're also stressed, then their stress is something that prevents them from eating healthy, something that also makes them overeat. So comfort eating and only reaching out for things that are easily available to manage, both those are playing a role. I feel one of the things that does need to happen is, I mean, I know we are talking about what women can do, but what people around them can do is also a huge thing to talk about. Because if there are other people who can take over some of the responsibilities, and taking over doesn't mean that they should be delegated by the woman. Often what happens when I see young couples, although I must say that it's changing a lot, I have a lot of young dads who are taking responsibility, and they are taking it proudly. They're not waiting for someone to tell them. But many times it's that everyone else is waiting. Okay, you tell me if you want help, I'll help you. That means the woman has to think first, okay, what all I have to do, what all someone else is going to do, and make a plan and then delegate it to someone. But there are, if you have a supportive network, people around can proactively take on, okay, I'm going to take care of this. I'm going to look after the baby. You sleep now. I'm going to feed you. What did you do? Did you eat? So I think there are very few people who ask the woman back. The woman is asking everyone in the family, what are you going to eat? How much have you drank or whatever? But very few people ask the woman back, have you eaten? So I think reciprocally taking care of each other's physical and mental health is very important. Also, I feel like how if your physical health is not looked after, your mental health can get affected.
Exactly. Yeah.
Often mental health can also cause physical symptoms. So many women who are not able to talk freely, are not able to, may not be able to express themselves. They present with aches and pains. They present with a lot of neck pain, body pain. They may have palpitations. So even people who may pick up on someone having a lot of multiple aches and pains or multiple physical problems, they may have to consider thinking that maybe there is some underlying stress that is contributing to it.
Yeah.
So the relationship is reciprocal. And that I see a lot happening in pregnancy and postpartum as well, because there is a understanding that there are physical symptoms that are going to happen, but a lot of them are contributed by stress.
Yeah. Okay. Dr. Divyambika, you raised your hand, ma'am.
No. Sorry.
Yeah. Dr. Asviakal.
Yeah, because of the stress these days, no, because females are taking a proactive role and they are working also, and as well as managing the house. The stress on them increases. So whatever stress is there for males, it gets multiplied for females because she has the added burden of the children, in-laws, and the whole house on her head. So they develop a lot of adjustment issues. So adjustment disorder is the major thing which can happen. And then you have depression. So then anxiety disorders and interpersonal issues, marital discord. So all these things can happen if the stress is too high. And the best way to deal with this is to have a healthy routine. So early morning sunlight is what prevents a lot of these disorders. So expose yourself to sunlight for at least 10 to 15 minutes, and it could be even half an hour. So that is a very, very important thing, and sunlight cannot be replaced with vitamin tablets. Okay, so basic, the first and foremost thing I would advise all my patients is to have that half an hour of sunlight in the morning every day. Start your day with that, and then you can proceed with your routine. And always include some activity which de-stresses you. Like after your day's work, have some 10 minutes or 15 minutes to yourself where you're de-stressing and doing things which you like. It could be meditation, it could be relaxation techniques, it could be deep breathing, or it could be just watching something you like, some documentary, listening to music, or just dancing, whatever pleases you, whatever you like. If you are not able to indulge in hobbies, like because we don't have time these days, hobbies, become difficult, at least do this much for yourself. Okay. And take breaks. So from your busy schedule, you should take breaks frequently. Okay. And pamper yourself. You can go for a massage, you can go for walks or treks, or just take a week off. Do those things. Just pamper yourself. In this busy life, we forget about ourselves. So we need those breaks intermittently. And if you have issues, always discuss it with your friends. Always have a bunch of friends whom you can trust, and always talk it out. So it is always better to talk out. They will give you, your friends will give suggestions, practical suggestions, which nobody else can tell you. So have that good set of friends. That social communication is very important. Then you need to have a good support system. Even at home, develop good support system. You're bonding with your in-laws, with your family, with your parents, with your husband. So all that should be good. So give importance to your relationships, and you can allocate your work. So whenever you are busy, the other people can pitch in for you. So have that good communication system at home. And your sleep is also very important. So have around 8 hours of sleep. Minimum 6 to 8 hours is very important. And seek help. If you're not able to deal with your issues, you are having issues, seek help initially itself. Don't let it become big. Usually patients come to me when they are getting divorced, or they are about to get divorced, or something major thing happens, and the whole life is upside down, and things are blown out of proportion. Things become easier if you come earlier. Okay. So I would advise them to seek help immediately. Okay.
Yeah.
They can go to any mental health professional and talk it out.
Yeah.
And concentrate on your nutrition. So tryptophan enriched foods, like you can go for any protein rich food, green leafy vegetables, nuts. So these are all very important for your mental health. Tryptophan is the building block for serotonin. So if you eat these kind of foods, you are more like protected from having depression or anxiety.
Yeah.
And I would like to stress on one point, that is your sex life. So oxytocin is very important to keep you going. It helps you keep motivated in your life. Okay, the monotonous, mundane things also become easier because of oxytocin. So it happens with physical contact. So if you have children, cuddling them, and the sexual intercourse with your partner is very important. So if you have a healthy sexual life, it prevents a lot of discord. It prevents a lot of issues at home. So don't neglect that. Give importance, equal importance to that as well. People forget these days in their busy life schedule, that just takes a backseat. So stress on that, give equal importance to that as well. Don't forget that one thing, and always feel free to seek help. Their mental health professionals are available, or they're online, and they're there everywhere. So they're just a step away. Just seek help if you need it. Thank you.
Thank you, ma'am. Thank you so much. I think by discussing all the aspects, I think the summary, I think it's all about seeking help, right? So even with perinatal, even with gynecological issues, even with addiction issues, I think it all boils down to seeking help. And to end this conversation, I would just give you a small anecdote that we have heard of somewhere last week. My colleague and I was discussing about, there's a family who actually gives a break to all women on a 1 day in a week. So they just don't make the women work, cook, clean, nothing. They all the things that they do is they just go out with their mothers, sisters every time. All 3 days, all 3 times meal is outside. And they say that women needs a break at least a day in a week. So I think there are families supporting that way. There are people who are coming out and seeking help. There are women with postpartum issues coming and talking to psychiatrists like Dr. Ashlesha, and also any kind of gynecological issues. Thank you so much, doctors, for throwing up so many aspects to this particular topic. Once again, to the viewers and everyone, Happiest Health is organizing a summit on women's wellness on 16th March 2024 at St. John's Auditorium, Bangalore at from 9 a.m. To know more about the summit, please log on to www.happiesthealth.com and book your seats. Thank you so much, panelists, once again, and we will keep connected in our future sessions. Thank you.
Thank you. Thank you for having me.
Yeah, thank you.
Thank you.